Hi all, this is Madan. How are you all doing? In this video, we shall see what is monkeypox, its symptoms, treatment and prevention. I have already posted a video of monkeypox and also about what is pandemic, epidemic and endemic. It will be useful and you will understand much better about this current situation if you can watch it. I am giving the link in the description. But do you want a two-word assurance from me about monkeypox? It is, don't worry. But I have to say, don't worry yet. I had said the same thing in my previous video too.
No. COVID is still not over. Just when COVID spread is decreasing, another disease of global emergency has emerged. That is monkeypox. The WHO has declared monkeypox a public health emergency of international concern. Sort of global emergency. There are now more than 16,000 reported cases from 75 countries and territories and 5 deaths. In India, there were 3 cases in Kerala and 1 in Delhi. It is important to note that this Delhi man has no travel history. The first question that comes during investigation and analysis is monkeypox a sexually transmitted disease? Who is at high risk of contacting monkeypox? It is men. Most cases of monkeypox have been seen in men. Men who have sex with men. Now you have to know about LGBTQ. It stands for lesbian, gay, bisexual, and transgender. Lesbians are women having sexual relationship with women. Gays is men having sex with men. Bisexual means a woman will have sex with both men and women, and the same case with men. Transgender means relating to a person whose sense of personal identity and gender does not correspond with their birth sex. So WHO has highlighted them. Secondly, healthcare workers. Prolonged and close exposure to treating the patient could lead to spread through droplets to skin contact as well, and people with prolonged health complications. What is origin of monkeypox? From where did it come? Monkeypox is not interestingly new or unusual. It was first isolated in the late 1950s from a colony of monkeys. The virus is in the same category of variola. Variola causes smallpox and vaccinia viruses. So how does monkeypox spread? It is a zoonotic disease. It means it is an infectious disease that is transmitted between animals to humans or from humans to animals. There is a significant role of animals in the spread of monkeypox. Man and monkeys both accidentally carry the virus in their body. But wild rodents are usually seen having this virus in their body. Rodent is a variety of rat. You may get infected if you are constantly with animals like monkeys, squirrels, wild rodents, or consume wild animal meat, or if you are in close contact with infected persons. Primarily, it doesn't spread via air, but if someone is in close contact with the infected patient for more than 3 hours and within 2 meters, they can get infection via large droplets. Here is an important point. It's less infective than smallpox and chickenpox. It can also spread through respiratory secretions of the diseased person by having a face-to-face direct contact with that person or performing intimate activities such as kissing, cuddling or sex.
Is monkeypox only a sexually transmitted disease? The WHO has said that for the moment this is an outbreak that is concentrated among men who have sex with men, especially those with multiple sexual partners. But it has also added that nations should have an unbiased opinion about this factor. Nations should protect both health and human rights and dignity of the affected communities. A normal skin will cover it after some time. But before that, if a person comes into contact with that person for a prolonged period, he may get infected with monkeypox. So, what are the symptoms of monkeypox? The first phase typically lasts up to 5 days. The person will get fever, intense headache, back pain, and severe fatigue. Swelling of lymph nodes can form in many different locations on the body or localized to several areas. Lymph node means a small bean-shaped structure that is part of body's immune system. Lymph nodes filter substances that travel through the lymphatic fluid, and they contain lymphocytes, and that lymphocytes is called white blood cells. These white blood cells help the body fight infection and disease. There are hundreds of lymph nodes found throughout the body. Now the next symptom is rash. The skin eruption usually begins within 1 to 4 days of appearance of fever and continues for a period of 2 to 3 weeks. This rash is painful and becomes itchy. Lesions will form on the face, then go to the palm of the hands and soles of the feet. Lesions means an area of abnormal tissue. Okay, now what to do when you get monkeypox? A smallpox vaccination, if given within 4 days, can prevent the disease. Although vaccination can be considered for up to 14 days of exposure. But doctors say that if given between days 4 and 14, vaccination is thought to reduce the symptom of disease but not prevent the disease. There are other kinds of treatment also suggested. There are two types of people. One is those with severe disease and another are those at risks for severe disease. For example, those younger than 8 years of age, women who are pregnant or breastfeeding women, and immunocompromised patients are at a higher risk. At this time, tecovirimat is the treatment of choice. Some other experts suggest a dual therapy with tecovirimat and cidofovir in patients with severe disease. However, experts also say few people require active intervention through medical treatment in younger people. This is an important point because people may believe in rumors and panic.
How can you prevent the spread of monkeypox? Isolate yourself to room for 3 weeks till all lesions scab and fall. There is a term called incubation period. It means the period between exposure to an infection and the appearance of the first symptoms. The incubation period of monkeypox virus infection is usually from 5 to 13 days but can range from 4 to 21 days. Dr. Giridhar Babu says that once it is in the community within a country, then the travel history is of no relevance. Traveler history is not an important criteria. He also says that there have been guidelines issued by Indian government. What are the vaccines against monkeypox? The smallpox vaccine only provides 80 to 85% protection against monkeypox. Even antiviral that has been recommended has no proven efficacy, said Dr. Rai. Vaccines are also not free of complications. The vaccines are also known to have serious side effects. They are not to be used randomly, said Dr. Babu. Learning from the lessons of COVID-19, India should keep adequate stock of these vaccines for any impending emergency in the future. Indian vaccine stockpile for smallpox was abandoned after the eradication of smallpox. We need a renewed focus on having vaccine stocks, he has said. In case someone has been in contact with the infected patient or animal, then he or she should wash their hands properly with soap and water or use an effective alcohol-based sanitizer. Wearing a PPE kit while treating the patient is a must for healthcare professionals and caregivers.
So, what is the vaccine news as on July 25th? The European Commission has extended marketing authorization for a smallpox vaccine named Imvanex for protection from monkeypox. Indian Health Ministry has said that there are currently no plans to procure smallpox vaccine to guard against monkeypox infections in India. Adar Poonawalla said that Serum Institute of India is in talks with Novavax to develop a vaccine for monkeypox. There is no need to panic because of the low death rate, but we should be well prepared for any emergency. Monkeypox is a self-limiting disease with low mortality. It doesn't lead to scarring unless immunocompromised, said Dr. Gupta. He also said that those who were born before 1977 are likely to have received smallpox vaccination and should offer them some kind of a protection. To conclude this video, I would like to say that don't spread rumors or believe blindly what circulates in WhatsApp. The bottom line is infections are usually mild and the risk to the general population is low. Thanks for watching the video till the end. Please like, comment and subscribe. Most importantly, share the videos widely. Thanks once again. Take care. Bye bye.